Hey, I'm going to go ahead and officially kick us off. So, welcome everyone to the fourth in our series of women's health education sessions. Tonight, we are very excited to be bringing to you a session called Expert Voices, Real Answers, a women's health, roundtable with three incredible experts where we will go through many of the questions that came in from members in advance of today's session, as well as taking some of the questions that are coming in live during the chat. Before we kick off, though, I do want to turn it over to Krista from OTIP to say a few words of introduction as well.
Okay, great. Thanks so much, Lori. Hello and good evening, everyone. My name is Krista Gingrich, and I'm a group benefits consultant here at OTIP. I'm so pleased, yet a little bittersweet, to welcome you to the fourth and final session of our OTIP Women's Health webinar series. The series was created exclusively for OTIP members in partnership with June Health and MemberRx, and it's been all about empowering women with the knowledge, connection, and tools to support health and well-being through every stage of life. The series began as a simple idea, a group of us women sitting around a table, talking openly about a shared journey many of us were experienced, but not always discussing. From early on, we recognized something very important, that the majority of our membership is female, and there's an opportunity to better support women through different stages of life. This led us to connect with experts who could bring evidence-based insight, compassion, and credibility to topics that too often go unspoken. Together, we created this webinar series, one designed to educate, connect, and empower women by offering a more complete picture of what happens during this phase of life and how to navigate it with confidence and support. Tonight brings everything full circle, not as a traditional presentation, but as an open conversation. We welcome three of our past speakers for a discussion created in response to hundreds of questions we received throughout the series. Brings together shared experience of expert insight, offering a thoughtful wrap up to the journey we began together. Women's health doesn't stop here, but tonight gives us a moment to pause, reflect, and carry these insights forward. As always, we value your feedback, so please take a moment to complete the survey at the end of today's session. So with that, I'm pleased to turn it back to you, Lori, and she will guide us through tonight's discussion and reintroduce our speakers.
Thank you so much, Krista. So, by way of introduction, I'm Lori Castleman. I'm the founder and CEO at June Health. We are very proudly partnered with OTIP for these sessions, and I do want to just take a moment, Krista, to acknowledge you for joining us on each of these sessions and providing a few introductory comments. And I also want to acknowledge the great work of the Women's Health Working Group at OTIP to select the topics, help us in terms of what are the important themes to your membership, and really work very much collaboratively to bring these sessions to life. So thank you so much.
Thanks, Lori.
So now it's my pleasure to introduce our panel of experts. The first is Dr. Rami Nitsch. So Rami is a board certified obstetrician gynecologist with more than 20 years of clinical experience and a deep commitment to advancing women's health. She is a co-founder and our medical director here at June Health, where she focuses on building and delivering the evidence-based care that helps women navigate their unique health journeys. Dr. Nitsch is also an associate professor and deputy department head of obstetrics and gynecology at Queen's University and has held leadership roles at Kingston Health Sciences and Sunnybrook Hospital. Rami is a deeply respected clinician, educator, women's health advocate, and partner, and I have no doubt we will all benefit from her expertise tonight. The second speaker on our expert panel is Dr. Valerie Vorstenbach. Dr. Val is a clinical psychologist and women's mental health specialist with June Health. Val specializes in women's mental health, including anxiety, depression, body image, sleep therapy, and life transitions. Her work integrates evidence-based therapeutic approaches with a deep understanding of both the psychological and emotional challenges that women face across various life stages. I personally know many women who have benefited from Val's support now, and I'm thrilled to have her with us tonight. And our third expert presenter, Heather Abbott, a holistic nutritionist. So, Heather is also our women's health nutrition specialist with June Health, and she is focused on supporting women's health through personalized nutrition first strategies and lifestyle supports. Heather specializes in midlife metabolism, hormonal balance, weight management, and sustainable lifestyle changes, helping women feel energized, supported, and in control of their health. Heather is a very dynamic speaker and sought after expert on the topic of nutrition, supplements, and healthy lifestyle. And I know that I always take away good tips and tools each time I have the opportunity to tap into Heather's wisdom. So thrilled to have you with us tonight as well, Heather.
Thank you.
Okay, so we wanted to start just by sharing some sort of personal stories and themes. And I thought I would kick us off. One of the things that's very important to us at June Health is really destigmatizing the conversations around women's health. And I will share, from a personal perspective, one of the great motivations, for me in building June and coming together with a great community like the speakers that we have today and really helping women to understand how to better manage their health came from my own personal experience. So I had a very challenging early number of years on my perimenopause journey. Really was faced with a number of very new symptoms that I would say came at me over the course of a number of years and really took me off guard. Have always been fairly healthy and fairly attuned to my own health, and these symptoms just seem to appear one after the other and really sort of throw things off course from a health perspective. And although I'm someone who's a pretty strong advocate for myself with my family physician, who I'm fortunate to have access to a family physician, I really wasn't getting clear answers as much as he's been a wonderful family physician, for us as a family over many years. When it came to my own personal symptoms, which I eventually recognized were part of a perimenopause and menopause journey, I really wasn't getting clear and direct answers. And, I found that pretty frustrating when I really kind of looked back over the years that these symptoms had been taking place and was able to get access to a qualified expert who provided very clear answers. And for me, that really just felt like, I would say, like incredibly frustrating because not only from my own personal perspective, for family, for friends, for community, of women that are part of my life, I just thought we deserve better access to care. We deserve clearer answers, right? And we deserve to be in great health and to be able to receive the treatment that we need to support the symptoms that we have much more readily. And I share that story because it was really a big part of the impetus behind June Health. And it's a lot of the focus on the work that we do, every day within the organization. And it certainly feeds into being able to be part of conversations like the one that we're having here tonight, where we're able to take questions and really help women navigate their own symptoms and health journeys by providing expert advice. So I am going to encourage everyone to share questions throughout the session. So just a couple of housekeeping items before I jump in, and I'll turn it over to you first here, Rami, in tonight's session. But as I said, before I jump in, want to encourage everyone to put any questions that they might have throughout the session into the chat. We'll do our best to try and respond to some of those questions throughout tonight's session. And I'm also just recognizing that we wanted to take a moment here to reference Wordly. So, okay, perfect. Here we go. So if you are looking for French translation, you can actually just click on this QR code, and the Wordly app will help you receive translation for tonight's session. So please just click on the QR code, follow the directions, and you'll be able to see your French translations. We also do want to get your feedback. So If you are able to scan the QR code and open this app, you can sort of keep it open and provide answers or responses throughout the session. We'll also share this QR code at the end of the session as well, so that you're able to share, sort of feedback at the end of tonight's series. So really, really encourage you to take a moment to share your feedback. It's very important to us and really does help to frame how we plan future sessions and also educational materials. Okay, so without further ado, Rami, I am going to turn it over to you. And I'd really love to sort of turn the baton to you as well to share a little bit of a personal story or professional story around your motivation for your focus on women's health.
Okay, thanks everyone for having us tonight. We're all looking forward to answering these great questions that are coming through and continue to come through. One more housekeeping item. I'm also going to be monitoring the chat. We'll bring some of those questions forward, but I'll answer some of them directly into the chat because that seemed to work really well in the past. I'm going to start with a little bit of a reflection. So, as an obstetrician gynecologist, I do many things during the week. Sometimes I cover labor and delivery, sometimes I perform surgery, and then the rest of the time I spend my time in clinic. So, last week I was in the operating room. And I was about to perform a procedure on someone that had been my patient for many, many years. And she said, um, do you remember when I was having my last child? I'm like, yes, because I was also having my last child. We were having our last children together. And I said, well, thanks for everything. I guess we're done here. And I said, well, keep in mind that, a lot of people tend to come back. And so it actually made me strike up a conversation with some of the medical students and residents that work with us. And they were asking me why I went into obstetrics and gynecology. And so I explained to them that the very first time I was in an operating room, it was during a cesarean section. And to me, it felt completely unreal. I had not had my children myself at that point. I was probably about 23 years old. The room was really bright, but it was calm because it wasn't emergent. So there was no chaos. And I kept looking over at the woman who was about to have a cesarean section in complete awe. And my heart was racing, and I was wondering if I belonged there. And then it happened. This baby came out, and the mother and father were laughing and crying at the same time. And, at that moment, I realized, that was really where I wanted to be. And so years later, I'm not just observing anymore. I'm treating, I'm reassuring during the various chapters of people's lives. So, it might be a young person asking if their menstrual period is normal, or a woman who's trying to balance her career and get fertility treatment, or someone navigating perimenopause and menopause. And what makes the work really meaningful for me is not really my skill, but it's actually my understanding. Just as Lori emphasized, she had been going through symptoms and had to advocate for herself. And so I've lived through many of these life stages, some of them profoundly uncertain with significant changes. And so it's really this shared experience that makes my job, incredibly rewarding. And so, I kind of get to be there for all of it. And that's what I love about it.
Thank you for that, Rami. I will say as well, I mean, the first conversation that we had about, the focus on women's health, we came together very quickly with that shared passion for being able to provide, better answers to women more broadly. So I can definitely appreciate, that background and that personal perspective as well. So I want to ask you a couple of key questions just to
Yeah,
kick us
for
off
sure.
here, Rami, and then I'll turn over to our other panelists to Heather and Val to answer the same question, and we'll dig into some questions with each of them as well. So first set of questions for you, Rami. So what is actually happening hormonally during perimenopause and menopause, and why do symptoms vary so much between women?
Yeah, that's a good question. So if you think about there's two really important hormones, so estrogen and progesterone. They're both produced by the ovaries. So before we hit that perimenopause and menopausal stage, for most women, they function in a highly structured way. And during perimenopause, the fluctuation sort of starts to lose its sync. And so that can start to result in some of the symptoms that women feel. So they might feel things like, they might experience things like irregular periods. They might start to, experience some things like sleep disturbances, those hot flushes and night sweats. That perimenopausal time can last up to a decade for a number of women. Where women often get discouraged advocating for themselves is they reach out for help as you did, and they're told, well, you're not in menopause. So these surely are not those symptoms. When we actually transition into menopause, our periods have stopped for about 1 year. That's the actual definition. But the symptoms still carry on into that phase. And so, really, it comes down to a constellation of symptoms because the estrogen and progesterone that our ovaries are responsible for making are starting to fluctuate. And for some women, that actually results in quite significant chaos. And that's why we have the various treatments that we advocate for.
So I want to ask a follow-on question to that. It's one we get often. So you mentioned that the clinical definition of menopause is 12 consecutive missed periods.
Correct.
Women can have symptoms for many years before they hit that milestone.
Yeah, absolutely.
Can you talk a little bit about access to hormone therapy before hitting that milestone?
Yeah, so first of all, it can be an incredible challenge because what we know is that less than 7% of family practitioners feel comfortable in that particular window. But it's a really important window to consider starting hormone replacement therapy or what we now call menopause hormone therapy for women during that window. There can be a huge health benefits starting hormones earlier than in the menopausal time frame. And most importantly, it really can improve quality of life for women. So if you find yourself knocking on a bunch of doors, really trying to advocate for yourself, make sure you get to the right place because I think, by the time people get to see me, Lori, it's exactly your story. They've been trying to advocate for themselves for a number of years and like essentially getting told, nope, this is not your time to start this medication. And the medication is profoundly life altering for many, many women.
Yeah, absolutely. I can certainly echo that. It was very much profoundly life-altering for me within 2 weeks. For me, the medication changed what were 5 to 6 years of symptoms that were very frustrating. So, that is just my own one personal story, but I know we hear it very commonly, and you certainly do in your practice as well, Rami.
Yeah, a little bit of a funny story. A parent set, husband and wife, they play on one of my child's sports teams, and the mom reached out. She's like, "I'm just not feeling like myself. Like, I just need to talk to him." I'm like, no problem. Let's set up an appointment. And sure enough, it's your story, Lori. So we started her on hormones, and then the next time we were at the sporting event, her husband tapped me on the back and said, "Thank you."
I love that.
That's why this is a conversation for men as well, right? Like
Exactly, Heather. You're
it's
100% right.
we welcome
Exactly.
everybody because everyone is affected by this transition.
100%.
Yeah.
Okay, so Rami, follow-on question that came in from one of the members. So, how should women be thinking about hormone therapy today compared to what we were told 10 or 20 years ago?
Yeah, that's a really good question. So, I feel that we're actually in a better time, but let me just take you back to a few decades ago where a very large study was completed that basically alerted the medical community that there were significant risks in taking hormones. This basically ended hormone prescribing for over a decade from many practitioners, much as myself. And if they were prescribed, it was out of an abundance of caution. Um, you know, thank goodness for science. The whole trial was, revisited. And fortunately, it demonstrated that hormones in the, appropriate person having gone through the appropriate evaluation are incredibly safe, actually offer significant health benefits, and improve quality of life. So I feel that we are exiting, more of the fear phase, and we're entering the advocacy phase, where we really do see the benefits of hormone replacement therapy. Following the news, there always used to be a black label on hormone replacement south of the border that has been removed, and that's significant progress for women's health.
And the last question for you, Rami, that came in, well, there's many more, but the last question in this series. So, what are the biggest signs that something is not normal and needs medical attention?
That's a broad question, so it depends
Mhm.
a little bit in the context. But the first thing I would say is if you don't feel like something's right, get medical attention. It might be very normal to have some irregular bleeding, but it also might alert us that something's wrong. If you're on hormone replacement already and you're experiencing something like problematic bleeding, we certainly as health professionals want to know about that. So advocate for yourself. If you feel that something's not right, you're usually right about that, and it warrants looking into.
Absolutely. Okay, Heather, I'm going to bring you into the conversation now as well. So I thought I would start with the same question that I asked Rami, and really wanted you to take a moment to share why you're so focused on women's health within, your practice and the work that you do, and why it's important to you personally.
Sure. Yeah, so first of all, I want to say I'm honored to be here on a panel with these very esteemed doctors. So thank you for having me. I'm like your layperson here, ladies. I go back to basics, and my journey with nutrition started when I was a kid. I was kind of the ugly fat kid that never got picked for the team, and I just didn't identify with that person. So my journey with weight loss started at that time. It wasn't a healthy journey. It was the Scarsdale diet. It was basically starving myself. And I went through those patterns kind of up until my 40s, maintaining my weight, mainly for vanity metrics, to be perfectly honest. And then I became a mother, and people around me started getting sick. And I really realized that maintaining my health and looking after myself was so much more than vanity. It was about being healthy and well when and if disease hit me or someone that I loved. And that's how I got into this journey in health and nutrition. And I'm focusing on women because we hold everything together. We are the glue in our families, we are the glue in society. And quite often at this stage of life, when we are going through this transition, we just don't feel like ourselves. And quite often, women lose jobs. Quite often, relationships fall apart. Just going back to what Rami said, the husband said, thank you. This is a trying stage on everybody around us that loves us. And I know the power of nutrition. I've studied it. I've read the research reports. As healthcare practitioners, we're all going to agree that a healthy diet and a lifestyle is the foundation for long-term health. And in the event that disease does hit, if we're in prime fighting form, we're going to be much better able to fight that, both mentally and physically. So that's really my passion. I want to keep women in the workforce. We are at this stage of life, we are full of wisdom, whether we've had careers, whether we've raised children, we have a lot to offer. So let's get us out there. Let's get us vibrant. Let's get our brains working again. Let's support our muscles so we don't fall and break a hip and we can't go out and do all the wonderful work that we're meant to do.
I love that. Thank you for sharing.
Yeah.
So I'm going to jump to two of the anchor questions that came in for you as well, Heather. So the first is, where do supplements actually help, and where can food alone be enough?
Well, we hope that food alone could be enough. In an ideal world, I'm a holistic nutritionist, meaning I am going to promote whole foods first. The reality of the world that we live in today is that our soil is pretty and nutrient deficient. We live in this industrial world. Our fields are surrounded by highways and environmental toxins. So there's a lot of things, even if we have an organic farm, there's cross-pollination, there's cross-contamination. Everything that we live in, everything we put on our bodies, how we clean our clothes, how we clean our houses, all these things can decrease the nutrient quality in our food. So fundamentally, if you can follow the Mediterranean pattern of eating, that's something that we all agree on. In nutrition science, that's where most of the research is done. That being said, it's not always realistic that you can get all of your nutrients from a whole foods diet. So I would say vitamin D, number one, is something that you just really can't get enough of. We live in the Northern Hemisphere. We don't see sunlight for 6 months of the year. And when we do see sunlight, we're covered with hats and sunscreen. So we're not getting vitamin D naturally. So absolutely supplement with that one. Most women are not getting enough omegas in their diet. We get our omega-3 fatty acids from fatty fish. We can get some from algae as well. But unless you're eating fish kind of 3 meals a day, you're not going to get enough. The omega-3s are really, really good for our cellular health, good for our vascular health. So I would incorporate those into our diet as well. Magnesium is one that really, really helps, really, really hard to get in the diet. We know it helps a lot of women with sleep, with relaxation. So that's, another one that I think that we would probably incorporate there. So, those are my top 3 that I kind of recommend for all women. You have to look at your diet. If you really are having trouble getting a nutrient-dense diet, a really great multivitamin could do the trick and just top you up. So the only things we really need to do testing for are vitamin B12 and iron. Don't take those unless you're deficient in them. And just know what you're taking and know that it comes from a reputable source.
I think it's such great advice, and I love the specifics, right? Like the specific direction to women on what to really look for. There is a lot of noise in the supplement
A lot of
space,
noise.
right?
And we're a very vulnerable population, right? So I'd be mindful of anyone that says they have a miracle claim. This supplement is going to delay menopause or take away your symptoms. It's just not true. So just know that we're vulnerable and do your research, and you should be okay.
I
Heather,
really
I
love
just,
the, yeah, no,
sorry.
sorry. You go ahead, Rami.
Oh no, just when you say iron, I'm starting to feel really passionate about iron and women's health. And so, I would just advocate if people are looking at their lab value of their iron, you want a number over 80. The range of iron is very broad. Iron is really important for our health, and there's some new evidence that iron is actually really important for mental health. So iron is surprisingly hard to maintain, at a value that's like a good value, and working, with a nutritionist is a great idea because it's actually a big challenge for women.
Mm-hmm. Yeah, especially during the menstrual years, right?
Yeah, yeah,
So
for
many
sure.
women are depleted. I mean, if your energy is really low, I would highly encourage you get both of those checked,
Yeah.
B12 and your ferritin checked. Yeah.
I will say too, I love the point about a multivitamin, Heather. I
Mhm.
heard at some point along the way that a multivitamin is like an insurance policy
Yeah.
from a, sort of vitamins and minerals perspective, and we should all just be taking a multivitamin on a daily basis, right? To
Yeah.
just sort of protect and maintain.
Yeah. I just started taking a multivitamin just because, I'm human too. I'm not perfect all the time. So it just,
Mhm.
if you can afford it,
If
why?
ever they could bring back Flintstones, it's for our
Yeah.
generation, right?
Right.
Flintstones,
Absolutely.
the menopause version.
Yeah.
Yeah.
Okay, Heather, second question for you. So, and this is a very common one. So, we chose this as one of the anchor questions. So, why does weight loss become so difficult for women during menopause, even when exercise and diet haven't changed?
Yeah, that's a great question, and it's a very nuanced question. There's a lot going on in our bodies. So, um, body composition is actually one of the things that most women, complain about. So, I like to think of estrogen as our fat traffic cop. And when she was high in our body, she distributed fat to our hips and our butts, giving us, those lovely curves. And then as estrogen kind of started to decline, our androgen hormones came in and redistributed our fat and gave us, the nice kind of male beer belly, which nobody wants. I refer to it more as a muffin top in women, but it just all goes around our middle. And that is because it's called visceral fat, goes around our organs and our liver, because it's a very metabolically active fat, and that close proximity to our organs is a quick source of energy. So that's why that happens. Additionally, there's mixed research on how much our metabolism slows as we age. It's part of the natural aging process. I have looked at studies that say we burn about 70 calories less a day. I've seen other research reports that say it can be up to 300 calories less a day. So if we are maintaining a regular lifestyle, and we're not aware that we're burning less calories naturally at a resting rate, that can be part of the reason for the weight gain. Additionally, we generally at this stage of life, we're really, really busy. We are slowing down. A lot of us we're at the height of our careers. Our parents are getting sick. So we're a sandwich generation, right? Our kids are taking off. Our parents are getting sick. We're just not moving as much. We're not as committed to exercise. A lot of women will get to exercise if time it allows for it at the end of the day, but it's not something that's scheduled into our day to day. So there is that. We actually aren't moving as much statistically. Sleep is really important too here, and I have to mention it. The perimenopause transition affects our sleep for many of us. When you don't sleep, you don't have energy. You can't make good decisions. It throws your hunger hormones off, your leptin, your ghrelin, your cortisol. All of these things really change how we look at food, and they really influence the decisions we make and contribute to our energy. So it's really multifactorial why we gain weight during this stage of life, but it is a very, unfortunately, kind of normal part of the transition. Men and women. It's not only women.
Mm-hmm. Definitely an unfortunate but very common part of the transition, for sure.
Yeah.
And I appreciate that you touched on sleep too. And I think, that is a really good segue, Dr. Val, to bring you into the conversation as well. I know this is a key area of specialty for you. So let me start with taking a bit of a step back and asking you that same question. So why in your practice do you focus so much on women's health, and why is it important to you personally? Where does that focus and passion come from?
Yeah, well, first, excuse me. First of all, thank you for having me. I'm so happy to be here with Rami and Heather. So I'm happy to join this conversation. So, I think my rationale is going to very much echo Rami and Heather's rationale. So I think, we need to appreciate that as women, we have unique pressures and expectations that are placed upon us, but we also have these predictable hormonal transitions that happen during menstruation, pregnancy, postpartum, the menopausal transition, and all of these things will impact our mental and emotional well-being. So personally, I came to appreciate the impact of these pressures and the hormonal transitions following the birth of my first child. So the compounding impacts that we experience with the hormonal changes during the postpartum period, the role transitions, the identity changes when we become mothers, when, we welcome a child into our family, the reality of the postpartum period. So, the physical recovery after birth, the difficulties with breastfeeding, the grabbing whatever food you can eat while you have a baby in your arms, the sleep deprivation. I always tell people, there is a reason that sleep deprivation is a form of torture. And sleep deprivation is very real during the postpartum period. Those expectations that we put on ourselves that, we have to be able to do it all. We have to be the super mom. We can't ask for help. We don't engage in the pleasurable activities as much as we do. We have parameters or we have constraints put on us in terms of, movement and exercise immediately postpartum. So all of these things are very real. And unfortunately, when we don't pay attention to them, the consequences oftentimes anxiety, depression, burnout. We also don't talk about these things. So, I didn't really realize what the reality of being postpartum was until it happened to me. And I started talking to my friends. I started talking to family members about it. And I heard the same thing. It is really hard. So this is the dialectic of it all. Starting a family, having children is very exciting for many people, but it's also very hard and it's very challenging.
Mhm.
And this is what ultimately led me to want to, focus my attention on women's health. So, being able to validate women's experiences, empower them, help them to build resiliency, increase their confidence, improve their, well-being throughout all stages of life, not just in the postpartum period.
I can see that we're all smiling and nodding. I love that answer, Val. And I also really love the scope of care that you provide, right? So across so many stages of a women's health journey. One of the key things that you touched on was burnout. And, I want to transition that a little bit to mental load.
Yeah.
We've done a number of great sessions together, and I really love, your definition and the way you speak to mental load. So I wonder if we can start there. So can you talk a little bit about mental load and how that really impacts women?
Yes, for sure, for sure. So, I mean, when we think about tasks, we really need to appreciate that there's two components to any task. So we have the physical component. So the physical component is like the actual execution, what it is that we do. It's the observable piece, and it's the piece that oftentimes gets acknowledged. So people will say thank you for doing that task, or they'll express gratitude for doing that task. But the larger component is usually the mental or the cognitive load. This is the invisible part. This is the part that the people don't see or they don't acknowledge. So when we think about the mental component, this is the monitoring, this is the planning, this is the remembering, this is the scheduling. If you think about tasks as being an iceberg, the physical part is like the part of the iceberg that's above the surface of the water. Whereas the largest part of the iceberg is actually below the surface of the water. And that's what the mental load is. To help people appreciate the difference between the physical load and the mental load, I like to use personal or day-to-day examples that all of us can be familiar with. So I'll start with laundry. So the physical or the physical part of laundry is actually taking the laundry and putting it in the washing machine, moving it to the dryer, folding it and putting it away. So that's one piece of it. But there's a whole lot of mental load associated with laundry. So if I use a personal example, I have myself, my spouse, and 2 children that live in my home. We have a laundry basket in each room. So I have to monitor how much dirty laundry is there in each basket. But I also have children, and at this time of year, they usually wear 2 to 3 outfits a day because it is so muddy. So I not only have to monitor how much dirty laundry we have, I also have to monitor how much clean laundry we have. So the other day, my son walked out of his room and he said, "Mom, this is my last pair of pants." Okay, great. I got to remember that because I got to get a load of laundry done. So I got to monitor the dirty laundry. I got to monitor the clean laundry. Well, my kids are in activities. So my son plays hockey. I got to monitor when his next practice is, when his next game is. I got to have all of his equipment ready for him. My daughter does horseback riding. I have to monitor, when her next lesson is, make sure that her pants are clean, make sure that her boots are clean. And then I also have to look at my schedule to be like, okay, when am I working from home, or when do I have time to pop a load in and change it over? So we can see that, although we all think about the execution of doing the laundry, there's many components that actually take up much more of our energy and resources associated with laundry. And people just don't see them, nor do they acknowledge them. I think the other piece, story that I also want to add with this is when we think about the load, I would encourage everybody to think about, what do you actually delegate when you ask people to help you? So I can go back to using the laundry example. So my son comes out of his room and he says, "Mom, last pair of clean pants." And so I say, "Okay, I know I have to do a load of laundry." I might say to my husband, "Hey, do you mind popping a load of laundry in the washing machine?" What have I delegated? I've delegated the physical part of the task. I haven't delegated the mental part of the task. I'm still holding how much dirty laundry is there, how much clean laundry is there, when do they need this, and then scheduling when we do it. So not only do we carry a big part of the mental load, part of it is we also don't delegate the mental load. We only delegate the physical tasks or the physical load.
Right, so many thoughts. So here's the first one. You talked about monitoring the laundry baskets. There is the whole other element of just monitoring the clothes that don't land in the laundry basket.
That's for real.
Very true.
There's another statistic on this sort of topic of mental load that I read that I think really hit home, which is, I know there's examples. We can't sort of blanket that women always carry more of the tasks and more of the mental load. I think there's always like nuances and exceptions. But on average, globally, women carry 70% of the mental load of caregiving and household management. So, significantly a disproportionate amount that's sort of residing in women's minds as well, with that ongoing task and to-do list that is just always there.
Yeah, and the reality is it impacts us in all areas of our life, right? And
Mhm.
so if you think about it, when you're, you know, at work, oftentimes you're multitasking by doing your job and holding all of those pieces of information in your mind. So thinking about, oh, that challenge or that difficulty that my child's having at school, or, that play date that I have to schedule, or that birthday gift that I have to buy. So we're multitasking all of the time by doing the job at our work, but also by doing, the
Mhm.
mental load that's in our
Mhm.
mind. And we do know that there is also a bit of a gap in terms of the physical load piece where women tend to carry more, but the cognitive load gap is much bigger than the physical load gap.
Mhm. I want to ask a follow-on question on this topic, which is, so, we're explaining and talking about mental load. And I mean, certainly there's also sort of mood disorders and issues that can come into play that
Mhm.
also can contribute to burnout. We had a great question, which is effectively, when does someone know that something that perhaps initially felt normal but feels like it's becoming more overwhelming or progressing moves into the space of really warranting or needing professional support?
This is a great question, and I get asked it all of the time. So, we all feel anxious, we all feel sad. How do I know if what I'm feeling is normal or not normal? And I mean, I think the thing, first and foremost, we have to appreciate that we're all going to have good days and bad days. Life is filled with ups and downs, and it's normal for us to have challenging moments in our lives. Really, when we try to decipher what's normal and what's not normal, is one, looking at the duration of the problem. So, how persistent are they? Are they happening more days than not for extended periods of time? We also want to ask ourselves, do these things bother us? So if the symptoms are bothering us, then they probably warrant attention. And probably one of the biggest deciding factors is, are they impacting our life? And so the ways that we want to ask ourselves if they're impacting our lives are they impacting our ability to do our job? Are they impacting our ability to socialize with others? Are they impacting our ability to complete our household responsibilities, our parenting tasks, our caregiving tasks, whatever it might be? So really it comes down to duration, the degree of distress and how much it bothers us, and then the impact or like the interference that it has on our life. And I always say to people, um, you don't have to have a diagnosable mental health condition to seek mental health support.
Mhm.
None of us are perfect. We can all benefit from support at some time. And so if you're ever doubting or if you're ever questioning whether something is normal or not normal, reach out.
Mhm.
People can help and people can provide support, and we can also be proactive in terms of preventing challenges from escalating. I always tell people, the earlier you intervene, the less effortful it's going to be. It's never too late to intervene. We can always make change. It just might be more effortful if we're further down the path.
Mhm. It's great perspective and great advice as well. And it's also leading me into segue to the next member question, which is
Mhm.
really around sleep. Because I think what you're saying potentially does apply to sort of restlessness or poor sleep as well. So the question is, why is sleep so disrupted for women in midlife, and what's happening in the brain?
Yeah, so we know that, many women during midlife will experience sleep disruption. So we're looking at like 40 to 60% of women that report sleep disruptions during that menopausal transition or during midlife. And it's not really one factor that contributes to the sleep disruptions. So a couple of things that we want to think about that may contribute to the sleep disruptions are actual normal age-related variations that happen with sleep. So if we think about these normal age-related variations, a couple of things that we need to appreciate is as we get older, we actually produce less sleep. So as infants, we produce like 16 to 20 hours of sleep. As children, we produce 10 to 12 hours of sleep. When we're in young to middle adulthood, we're going to produce maybe 7 to 9 hours of sleep. And as we approach older adulthood, we're going to produce maybe even less than that. So this is important because sometimes what happens is we believe that we still produce the same amount of sleep. So we start spending as much time in bed as we would when we were younger, but our bodies don't naturally produce that. So we can end up developing sleep-related problems because we're living our life in a way that isn't actually consistent with the amount of sleep that we produce. So we need to keep in mind that the amount of sleep we produce may change over time. And we might need to do some monitoring in order to get a sense of how much sleep are we producing at this time, and then have our behaviors be in line with what it is that we produce. Another thing that happens as we age is we spend more time in light wave sleep, which means that as we get older, our sleep actually becomes more fragmented and more broken. So it is normal to have a bit poor quality of sleep as we get older. So this is just something that we want to keep in mind, that some of the fragmented and broken sleep that we might experience is actually normal, and it's part of the aging process. Thirdly, when we think about normal age-related variations or variability, the timing of sleep changes as we age. So in infancy, the timing of sleep is very variable. Babies sleep during the day, they sleep at night. For children, they're going to go to bed a little bit earlier, they're going to wake earlier. Adolescents, we're going to see a later time to bed, a later wake time. In early to mid-adult, we're going to see it creep back down. So we're going to go earlier to bed and wake a bit earlier. And then as we approach older adulthood, it's going to get even earlier. So the timing of our sleep will also change as we age. So these are the normal age-related sleep changes that happen. But as we've talked about, we also have hormonal transitions that happen during midlife. And the hormonal transitions themselves can affect sleep. So what happens is they can affect our circadian rhythm, which is like the internal process that happens that regulates the timing of our sleep. And when the hormone shifts affect the circadian rhythm, they change the signals that set sleep timing. And they do this through changes to thermoregulation. So during midlife, women experience hot flashes and night sweats. So a lot of women that I work with have to do full wardrobe changes in the middle of the night. So their sleep is going to be disrupted. And so obviously it's uncomfortable to sleep when you're very hot, but also when you've sweat through your clothes. And so when you wake up, sometimes you end up waking yourself up too much, and it ends up making it difficult to fall back to sleep. But there's also changes in terms of the melatonin production, which is a hormone that will signal the timing of sleep. So our circadian rhythm, or the timing of our sleep, gets impacted with the hormonal transitions. And we know that our stress hormone balance changes when we have these hormonal transitions. And so we can feel really wired, and it can be hard for us to sleep. So we have our normal age-related changes, but we also have the compounding factor of the hormonal transitions, which will impact things that naturally happen in our bodies to produce sleep. The other piece that's important to highlight when we talk about sleep, especially when we talk about the sleep disruptions in midlife, is the reason why the sleep problems begin is not often the same reasons why the sleep problem is maintained. So the age-related variations that people experience and the hormonal transitions that people experience may contribute to the onset of the sleep problem, so why it started. But because our sleep has become disrupted, we try to compensate for our lost sleep. So we change our behaviors. We, go to bed earlier. We try to sleep in longer on the weekends. We might nap during the day. And so we do a lot of behaviors that actually end up maintaining the sleep problem in the long term. Also, we start to get a lot of worry and anxiety about sleep because, I think as Rami and Heather and I have talked about, sleep is very essential for our physical well-being, our mental well-being, emotional well-being, cognitive functioning. There's a reason that we say sleep is the best medicine. And so when we start not having it, we start to become really afraid that we're going to continue to not have it. So we develop a lot of unhelpful thoughts about sleep. And so from a treatment perspective, this is ultimately what we're targeting. We're trying to change these unhelpful behaviors, and we're trying to change these unhelpful thoughts that are actually maintaining the sleep problem in the long term.
I think everyone, I again feel like I could listen to you talk about these things for probably hours, Val. I think everyone can relate to that the piece you touched on, that concept of getting anxiety over the hours of sleep that you are not getting, right? When you're restless and perhaps you have something big happening the next day and you're almost doing like the countdown clock in your head of, okay, now I'm only going to get 6 hours, 5 hours, 4 hours. So relatable for sure. Okay, so at this point, we're a little over halfway into tonight's session, and those anchor questions were really common questions that we received from members. So they may have had slight variations in the way that they were asked, but they were common themes for each of you in those anchor questions. At this point, we're going to turn to a bit of a different approach. I'm going to call it the round robin section of questions here. So there are many more. I can see we've got quite a few coming into the chat. And we had, as Krista said at the top, hundreds that came in advance as well. So we'll do a round robin. I'm just going to fire questions at each of you. Feel free to top up if you want to add to any of the responses, and we'll try and get through quite a few of these questions in the second section of the session tonight. Okay, Rami, first question. Choosing HRT or not, pros and cons, and what should most women do?
Yeah, very good question. So, our new term for HRT is menopause hormone therapy, because we're not replacing, we're adding
Mhm.
hormones when they're naturally declining. So, first of all, the pros. Well, there's the quality of life pros. So, they're going to treat those hot flashes that Val referred to. They're going to treat night sweats. They're going to help mood swings. They're also going to help what we call your urogenital health, so vaginal dryness, painful intercourse. And that's just to name a few. There are over 40 symptoms of menopause. But then there's some real health benefits as well. So they strengthen our bones, our lean muscle mass, and provide some cardiovascular, some real good health, heart health benefit. And the other key thing is if you start hormones at the right time, so probably in that perimenopausal time frame, they actually can provide some protection against cognitive decline and in some women, Alzheimer's. So the cons are really based on your individual risk. I don't think there are many downsides to starting hormones in the general population, but some people carry an inherent risk. And that inherent risk might predispose someone to developing a blood clot in the leg or lung, a stroke. Those are some of the more serious, side effects or adverse effects. But we're talking about 1 in 18,000 women. And then the other thing that comes up is the breast cancer risk. So when you look at the breast cancer population, it's a striking number. It's about 1 in 8 women in Canada will get breast cancer. When you look at mortality as it relates to breast cancer, there's no difference in women that started hormone replacement therapy and women that did not. But there might be a slightly increased chance of getting a breast cancer diagnosis. So I say the cons are few, they're usually risk specific, and there's many benefits.
Okay, two quick follow-on questions. There's a few that came into the chat around oral versus patch if you're taking MHT.
Excellent question. So, hormone replacement therapy can be given orally. You can put some moisturizer on your skin. You can wear a patch, and actually, some of it can also be taken vaginally. For many women, it makes no difference. Some might, feel that they treat symptoms one way better than the other. But for some women with specific risk factors, for example, I talked about blood clots, it's much better to take what we call a transdermal or skin approach because that way the hormones are not processed in the liver and the clotting factors aren't kind of activated. So if you're told that you can't go on hormones because you have these histories, make sure you're speaking to the right person because that's not necessarily so. There are alternative routes to take hormones.
Okay, second quick follow-on
I feel like
question.
I have to answer them quickly because it's like,
I know. The second one was quite a few questions around, is there a certain age where MHT no longer makes sense?
okay, so I just had someone in my clinic today, and she's 67, and her physician made her go off of it, and she was absolutely miserable. And so, the short answer is the recommendation is to be on it for the shortest amount of time possible. But, practically speaking, for most women, that's about 3 to 5 years. But I have my lifers. These are women that are never coming off menopause hormone therapy because they simply feel better on it. And the minute they stop it, they're miserable. And so I wasn't going to mention. Um, once again, it's just a really careful discussion with a practitioner, and it's just about weighing the risks and benefits. We do so many things every day that carry a higher risk than starting hormones.
Great point. Okay, next question from Agnes in the chat. Can you talk about, Heather, I'm going to direct this one to you. So, can you talk about remedies for postmenopausal poor digestion, bloating, and poor absorption?
Yeah, so diet journaling is a great thing to do.
Mm.
So it's really hard for us as practitioners to know what's going on unless we know what's going on. And quite often, as a person going through this, you don't really know what's going on until you track it as well. So number one, really track what you're eating and how you're feeling. So I'd say that would be the first thing to do. I don't have a prescription because of course I don't know what you're currently eating. So it's hard for me to tell you what to do. You want to look at the fiber content in your food. So, are you getting a balanced diet? Are you getting a lot of lean proteins? Are you getting a lot of fruit and vegetables that naturally contain fiber and they contain vitamins and minerals that support your gut microbiome? So, it's the prebiotic fiber and the probiotic fiber. So, you want to make sure you have a really healthy gut microbiome. Some people are very sensitive to, our typical high fiber foods like flax seeds, like psyllium, like chia seeds. I have a lot of clients that we put chia into their diet and they feel really, really bloated. So the microbiome does change as we go through this transition. So it just might be combinations of food that we're eating. I find a lot of people do better if they have their lean proteins with vegetables. And then if you keep your carbohydrates kind of on your own with vegetables. So kind of keep your carbs and your proteins away from each other. If things are super high fat, sometimes that really upsets people's digestion because it just slows down the digestion process. So it's a really individual thing, but I would look at your diet, write it down, track how you're feeling, make sure you're getting adequate fruits and vegetables in your diet and not too much of the typically fibrous foods. And if you're adding in probiotic foods like kefir or kombucha or things like that that you think might support your microbiome, sometimes too much is too much, and you have to gradually get up to these things and let your body adjust to them.
Yeah, I think your point, I'm having this sort of theme in my head of knowledge is power, right? So I think your
Absolutely.
point of journaling is a really good one, right?
Yeah,
Because you often sort of get to the end of the day or the end of the week and you can't quite remember what perhaps is causing the bloating or the discomfort or whatnot. Whereas if you're looking at that data,
yeah.
sort of building your knowledge base on a day-to-day basis, you know what you're working with.
Totally. And
Yeah.
I'd also say, which I should have put in there, as movement. So movement is
Mhm.
really, really good for your digestive health. So
Yeah.
not eating a full meal and then going and doing a full workout, but walking after a meal for 20 minutes just to kind of get things flowing, that can also ease the bloating, and also hydration too. If you're dehydrated,
Mhm.
that can cause some bloating and discomfort.
Yeah, absolutely. Okay, so I want to move on to the topic of brain fog. We had many questions on brain fog. And so, Val and Rami, I think maybe I'll sort of throw this one to both of you to touch on. So, you know, can you talk a little bit more about like clinically, Rami? Like, is brain fog real? Does MHT actually impact brain fog? And then I think Val, from your perspective as well, what can women do, like techniques and strategies to mitigate brain fog?
Yeah, brain fog is 100% real. Most of us have experienced it. I would say the two common times to experience it is postpartum and then, perimenopause and menopause. And actually, the most common thing I actually hear from women is they're able to do their job. And then, once they get home, that brain fog sets in. So if we go back to Val's laundry analogy, well, you can't even like hit the mental load of the laundry because you started to think about the laundry, but then you went and did something else. And then you have to remind yourself 10 times to go back and think about the laundry. And once again, it's related to that decline in estrogen. Estrogen is a really important power molecule. It's really important for brain function. So that's number one. And then all the things Val touched on before, right? So we're starting to lose sleep. That's going to compound the brain fog. And then Heather talked about the sandwich generation. So we're doing lots of things. So that's going to compound the brain fog. But there's a real biology that contributes to poor concentration and brain fog. So yes, there is in my world a role for menopause hormone therapy. And then, I recommend that a lot of people go and speak to someone like Val and get some real tools to sort of approaching their life at work and then just daily tasks in general.
And just to kind of jump in there, I think in addition to the hormonal transitions that we experience, we all do also have to appreciate, like you were saying, sleep is definitely going to impact brain fog. So when our sleep is disrupted, we're going to be more vulnerable to it. But we also know that during midlife, women are vulnerable to experience also anxiety, depression, and brain fog can be associated with these conditions as well. And so when we're looking at the treatment of brain fog, like Heather was talking about in terms of the monitoring piece with the food, we also just really need to get a very good understanding of what are the factors that are contributing to the brain fog for that person. So the treatment strategies are going to look different depending on what is contributing to the brain fog for that person. Some people, may find that the brain fog improves with MHT alone. Others may find that they need additional skills and strategies. And so from a psychological perspective, what we're looking for is we're looking at, what are some of these other contributing factors that are, potentially worsening or exacerbating the brain fog. We'll always start with sleep. So trying to, prioritize the improvement of sleep. Most women that I work with will notice that the brain fog improves when we improve their sleep. But we can also look at other kind of like lifestyle changes. So, if we start to prioritize some of our other lifestyle changes like eating in a balanced way, exercising regularly. I think a big thing in this piece is going to be looking at also the load distribution. So we need to figure out ways that we can delegate the mental part as well as the physical part. And so then sometimes we're looking at applying other types of strategies to help facilitate that delegation. So it can be the use of calendars, the use of to-do lists, just so we can get rid of some of that mental or cognitive load to help with that. So I think first and foremost, we just need to get a really good understanding of what is causing it and then apply the treatment interventions. Usually it's a combination of multiple professionals. So, all of us that are sitting here tonight could probably help somebody who is experiencing brain fog.
Mm-hmm.
Yeah. And I'll just say on a nutrition perspective, inflammation can cause brain fog. So if we're in a really inflammatory diet, a lot of processed food, a lot of sugar, a lot of processed fats, doesn't help our brain. And to go on with what I think one of you said, a lot of these, or Rami, you were saying women do really well at work and then they come home and they just don't have anything left. And that's when you've got to put dinner on the table for your family. And this is where it gets really, really hard. So a little bit of pre-preparation, having, maybe an hour on Sunday or Saturday or whatever your day off is, well, teachers, so Saturday and Sunday, you do a little bit of prep so that when you get home and that brain fog is really, really apparent and you can't think properly, you just pull stuff out of the fridge. So you've got pre-chopped vegetables, pre-chopped fruits. Maybe you have a whole roasted chicken in the fridge. Get it out, get everybody fed, and then your brain loves glucose. So give it some energy. It needs energy and oxygen. So exercise is important too.
Absolutely. I'm going to add sort of a layperson perspective here too, as well. I think it's important that we all sort of give ourselves some grace on this front. Like when you're struggling to think of the last name of the person that you're trying to reference, sometimes I think it's going to come back to me. Let's continue the conversation. And it does come back typically as soon as you stop thinking about it.
Yeah.
Okay, so next question, I'm going to direct this one to you, Heather. So there actually were quite a few questions about collagen.
Mm-hmm.
So what can help boost collagen production during perimenopause and menopause? Should I be taking a collagen supplement, and can you recommend any in particular?
So I don't have one in particular that I'm going to recommend. So it is hard, unless you're eating a lot of chicken feet, you're eating the skin of the fish, you're eating the skin of the chicken. That's where a lot of the collagen is. So not generally a part of most people's diets. You can supplement with things like bone broth, but unless you're making your own, the amount of collagen in it really varies based on, are you using raw bones? Are you using cooked bones? Are you roasting them first? Are you adding vinegar to pull out the good stuff? So bone broth is kind of hard. So you can get it from your diet. You get it from, your animal products. So that is great from animals. You also need vitamin C to create that collagen matrix. So you need your fruits, your vegetables, citrus fruits, spinach, leafy greens, that type of thing. That also, you want brassica family vegetables, onions, like the sulfur containing foods. So there's different components that you need for collagen production. There are amino acids that we find in our meat, like I said, and then you're looking for zinc, which you can find in oysters and shellfish, and the sulfur producing foods like the brassica vegetables, onions, garlic, that type of thing. Again, I'm going to go back to the Mediterranean pattern of eating. If you follow that pattern of eating, that is your best bet for getting a well-balanced diet. For skin health, you can supplement with collagen. Just be careful with what you're getting, and make sure that you've got a lot of vitamin C in it as well, and zinc to create that matrix that you need. Best thing for your skin is stay out of the sun and protect it.
Mm-hmm. Absolutely.
Yeah.
Okay, so a couple of questions on postpartum. So is postpartum brain fog permanent or can cognitive function improve? I think that's maybe a Rami or Val. I'll let either of you take that. And then there's a follow-on question on this theme as well.
Rami, do you want to go first?
Yeah, sometimes you feel like it's never going to end when you're in that postpartum phase. So, the postpartum is related to a few things. Like it is a profoundly emotional time. It is a profound fluctuation of hormones, and then for me, it's the sleep deprivation, which really contributes to quite significant mental health issues for a number of women, brain fog, concentration, depression, anxiety, and postpartum obsessive compulsive disorder. These are often not talked about. Women often suffer alone. If you feel that you're trapped in a long cycle, and you're not getting better, please reach out for help, because it's a really important time to get help for yourself, for your family. And I would say in Canada, it's still not talked about as much as we should be talking about, postpartum health. So reach out and get help if you feel that, your symptoms are lasting, longer than they should be.
Just a quick follow-on question on that theme that was asked specifically for you, Rami, as well. So one of the members in the chat asked for your insights on mental health for women who are pregnant, especially those who are in a situation of unplanned pregnancy. And I think probably Val, you may want to share some thoughts on this front as well.
Do you, sorry, just was the question just what the mental health support is?
Mhm.
Yeah,
On
so
maintaining mental health while pregnant. So you touched on postpartum. I think that similar applies during pregnancy.
yeah, so I really liked what Val said earlier about, trying to get the help as early as you can. Because the further along you are in the process, the more, challenging it is to mend some of the things. I think there's a greater recognition out there that we need to pay attention to women's health, mental health in pregnancy and in the postpartum period. Many practitioners are aligned with mental health support. So, I think it is really important to bring it up when you're pregnant. That is a really good time to get help. Often, after the baby comes, you're incredibly busy. Women feel that they can't even make it out for an appointment. Like there's no one to help them take care of the child. And so if you can get some help early on, start to develop some tools, you're better prepared for the postpartum period. What we know is that of women that have baseline mental health issues, for example, anxiety and depression, there's a 10% chance they're going to have a significant postpartum depression or anxiety after the baby comes. And so, getting those tools, support, care early on is really important. And particularly, you mentioned an unplanned pregnancy. That can be incredibly stressful.
Mhm.
Women often don't feel supported. This wasn't a time that they were choosing to have the child. There can be many life stressors. And once again, a practitioner myself can really easily connect people to social workers and other help in the community that can really help put people, on a good path to enjoying their pregnancy and feeling well supported when the baby comes.
Thank you,
Just to
Val. I
set,
want to give you a chance to weigh in on that one too.
yeah, I think I mean, I kind of alluded to this when I was sharing like my own personal experience and what led me to focus on women's health is, I oftentimes tell people you can't really appreciate being a parent until you're in that role. And part of what I mean by that statement is we all have times in our life where we're sleep deprived. So like if we went through, post-secondary school, we had exam periods, we had midterm periods, or, if you had times in your life where you were socializing a lot and you were, prioritizing your social life over sleep. The problem is that these are all temporary. And so we all have had times where we've been sleep deprived, but they've been temporary. And until you're really in the situation where the sleep deprivation is ongoing and is persistent and is the consequence of another person, meaning somebody who is dependent on you, you can't fully appreciate how sensitive some people actually are to the sleep deprivation. The other thing, in addition to sleep deprivation, is there's ways that we can live our life that reduce our vulnerability and keep ourselves well. And so these are all things that we want to prioritize. So, we want to be regularly participating in pleasurable activities and balancing that participation with what we describe as mastery based activities. So these are activities that make us feel good because we've accomplished or achieved something. So they're like the items off of your to-do list. We also are treating physical illnesses when we are functioning well. We are balancing our eating. We are balancing our sleep. We are, engaging in regular movement and exercise. If you think about the postpartum period, there's changes in all of those behaviors. So you're now prioritizing the well being of your child. And so you're not engaging in the pleasurable activities that you usually engage in. Sometimes you're not doing, some of the household responsibilities that you've been taking care of before. You know, I mean, I'm sure Rami can allude to this a lot more than I can, but like the physical recovery associated with childbirth is large. Like a cesarean section is a surgery that a woman is having. There's lots of tearing that can happen when you give birth vaginally. And so we also need to make sure that we're prioritizing that physical recovery, which sometimes is hard to do immediately postpartum. We've already talked about sleep. I'm sure Heather can allude to or can relate to the eating changes that happen for women in that postpartum period. And so, because we know all of these things change, we can actually use the time in pregnancy to prepare and to plan and to set up a structure and an environment so that we can try to reduce the impacts as much as possible. I think the other piece that's important to talk about, I have so many conversations with women in pregnancy and in postpartum about medication. Women are very afraid of using psychotropic medications to maintain their mental and emotional well being when they're pregnant or postpartum because they're afraid of the impacts of the medication on the fetus or on the baby if they're breastfeeding. The reality is that medications, there are a lot of medications that are safe, and there are consequences of being mentally and emotionally unwell, and we have to work with women to help them evaluate the pros and the cons of using medication to help support their mental and emotional well-being during these times in life. Rami talked about, for women who have a history of mental health difficulties, the incidence of mental health difficulties in that postpartum period can be higher. But we also know that women are more likely to have mental and emotional health difficulties if they stop their medication that they were using before pregnancy. So I have lots of conversations with women about the pros and cons of discontinuing medication or even starting medication during these times. And so it is something that is important to consider, and it's important to talk to people who are credible and reliable. And so this is where, reaching out to psychiatry who has experience with pregnancy and postpartum can be helpful. Even talking to people like Rami, OBGYNs who have more experience with that. Because sometimes women receive unhelpful messages about the role of medication.
Very helpful. Thank you. I want to stay on this sort of stage and the topic of, fertility, pregnancy, postpartum. So a couple of quick questions here for you, Rami. So first is fibroids and fertility. Will I need surgery or are there other options?
Yeah, that's a really good question. So, for people that are not necessarily aware of what fibroids are, they are benign, what we call smooth muscle masses that grow in the uterus. They can be very small, and sometimes they can grow as large as 30 centimeters. They can cause symptoms like bleeding, pain, bloating. And many women who have fibroids do not have fertility issues. So it really depends on the size of the fibroid, the location, and other potential symptoms. If you work with someone like me, if you're trying to do pre-pregnancy planning, we look at all of those things. And then we decide, do we have to try to shrink the fibroids with medication? There are some new procedures right now where they use ultrasound to actually reduce the size of the fibroids. Then sometimes we actually have to take them out before pregnancy. So all this to say, they may or may not impact fertility, but it's really important to have a discussion with a physician such as myself if that is potentially going to be an issue.
Adenomyosis. Do women just really have to live with it?
Well, a lot of women do. So what adenomyosis is so the lining of your uterus that sheds during your menstrual cycle is called the endometrium. And when the endometrium grows into that muscular wall of the uterus, that's when women develop adenomyosis. Typically, the age of onset is in the 40s. That's why women, often in their 40s, start to experience increasingly painful periods. They might experience bloating and heavier bleeding. And also, in that perimenopausal time frame, estrogen starts to fluctuate, and that can sometimes actually worsen the symptoms. Adenomyosis can be really tricky to diagnose because it's not always clearly seen on something like an ultrasound. So someone like myself would really do a careful review of symptoms. And certainly you do not have to live with it. There are lots of treatment options from pain medications, anti-inflammatories. We use lots of hormones. to help with the symptoms of adenomyosis. And I would say it is probably one of the more common indications for hysterectomy in someone in their 40s.
Can you also touch on two other areas? So PCOS and endometriosis. Would love to have you, like, similarly speak a little bit more about each of those two conditions and how women may be able to identify.
Yeah, perfect. So let's talk about endometriosis first. So endometriosis is a condition where the uterine tissue grows outside of the uterus. So it might implant on the ovaries, the bowel, the bladder. There are also descriptions of endometriosis implanting in the lung. For some women, they may not have it. They might not have very many symptoms, but for many women, it causes quite significant, debilitating chronic pain. It can take up to 7 years of seeing specialists to, have someone finally diagnose and start to treat you with endometriosis. It is important to treat because it can lead to chronic pain, it can lead to mental health issues, and can be one of the reasons that women might be experiencing infertility. There are a whole range of options from both medical, also, to surgical options. And then when we talk about polycystic ovarian syndrome, we know that 1 in 10 women in Canada have what we call PCOS. PCOS is a metabolic condition. It is a result of number of factors, but simply put, your estrogen is not firing in a predictable pattern. So women might notice that they have irregular periods. And the real problematic part of PCOS is it really affects metabolism, and so women with PCOS often gain weight a little bit more quickly than someone without PCOS, and then it's much harder to lose. Women might also have acne, hair loss, and so those are some of the symptoms associated with PCOS. So when you come to see someone like me, I might start to evaluate some of these symptoms and start to treat, offer women, medical options like hormones. And then working with someone like Heather, when you have something like PCOS is really important because it can help with diet, metabolism, getting people back on the right path. Even a small weight change with PCOS can result in a significant resolution of symptoms.
So you talked about 1 in 10 women struggling with PCOS. What's the sort of probability or the statistic around endometriosis?
It's about 1 in 7, so it's really
Right.
quite high, but that's a range of symptoms. So you're going to have some people who don't know that they have it, mild, and then, you're going to have quite like a significant portion that have under-recognized but severe symptoms.
I think it is important to, again, it's knowledge is power, right? So I do think it's important to sort of understand the data and understand the prevalence because, as you talked about, Rami, I think so many women just dismiss their symptoms
Or get dismissed.
or get dismissed,
Yeah.
right? And understanding the data and the prevalence, I think, really can provide a sense of like courage and confidence to really advocate for yourself to get the answers that you need.
Yeah, absolutely.
Hmm. Okay, I want to switch gears to a couple of additional questions here. So, one, Heather, I'm going to direct your way, which is, again, I think something that we see really commonly. Women, as they're aging, struggling with hair loss. Are there any, tips or recommendations from a nutrition perspective to improve hair health? Hair and skin, probably.
Yeah, I don't know. That's a good question. Specifically, hair. Generally, hair, nails, and
Hmm.
skin all go kind of hand in hand. And I'm sorry, I haven't done any research on hair, so I don't know if there's anything specifically. I would go back to a whole foods based diet that has all the components that we need. So we want really good protein. Protein has all like the collagen, the keratin, all those things that are part of the foundation of the hair. Um, your omega-3 fatty acids are really good for skin, like fat. Your skin likes that type of thing. A whole foods based diet. you
Hmm.
know, I would try and, be mindful of how you're looking after your hair too. You
Hmm.
know, constant washing, constant brushing, harsh chemicals in your hair products is probably not helping either. So if you can go as natural as possible. Yeah, so I'd say just whole foods diet and watch, what you're putting in your body and what you're putting on your body.
Absolutely. Lots of questions around energy as well. So that was my
Mm,
fast follow for you, Heather. Any
okay.
recommendations? And we can turn it to everyone as well on this one, because I do think common question, we're all looking to have a bit more energy in our days and in our lives.
Yeah.
Any recommendations to increase energy through diet?
Yeah. So I'll let Valerie talk about sleep. Sleep's number,
Mhm.
proper rest is number one, and we've talked about that already. Diet for sure. Hydration, I want to talk about a lot with energy. A lot of people mistake hunger, mistake hunger, and it's actually thinking they're actually dehydrated. So you need fluid in your body, and that really will increase your energy. One of the main things we can do for energy is I want you to prioritize your protein at breakfast. So when you prioritize your protein at breakfast, and that doesn't mean that you have to eat breakfast at 7 o'clock or 8 o'clock, but your first meal of the day sets your blood sugar and your metabolic tone for the day. So really, really focus on that. So 30 grams of protein at breakfast might look like 2 eggs and 3/4 of a cup or a cup of cottage cheese and yogurt with some berries or fruit. It might be an easy protein shake that you can pre-package all your vegetables and fruits. And then in the morning, you just add your milk or water of choice, your protein powder, and you blend that all up. So yeah, protein first at breakfast is really, really important. And then the mid-afternoon, instead of going for that coffee or a little bit of chocolate for your energy, what you want to do is you want to oxygenate your brain again. So look at hydration first, and then get up and get moving, because that will really increase your energy. And then again, a protein forward snack with a complex carbohydrate.
Fantastic. I just realized we just have a few minutes left here. So we've popped the screen back up. Really encourage everyone who's on the call to just take a moment and share some feedback on the overall series, as well as feedback on tonight's session. We would love to hear from you. We really do closely look at your feedback. So really appreciate you taking a moment to share some. And I want to turn it over to the panel to just share quick closing notes.
I'll just make a little comment. If you listening to us all, when Val said sleep is the best medicine, I thought, well, Heather would probably say food is the best medicine. And I'm probably going to say medicine is the best medicine. But really, like, it's just such a reflection that every women's health issue is best served by that holistic approach. You really need a lens. From, mental health and diet and a physician. And I think, that's the best way that we're going to be able to optimize, our collective health.
Yeah. I'll echo that. I'll say, you know, lifestyle is the foundation of everything. Really get that in order. It is going to serve you, but where medically indicated, please see a practitioner. So someone like Rami, someone like Valerie, we have a whole team at June that can help with specific needs. So yeah, nutrition, sleep, movement are your foundations, but there's additional support out there. And if you're really struggling, please seek help.
And I'm just going to follow that up with it's never too early to seek help. And so, yes, sometimes we're responding reactively to symptoms that people are reporting or experiencing, but we can always do a lot of things proactively. And so, as soon as you notice change, reach out for help. There's lots of things that are treatable, and there's lots of things that many people can do to help. And so, it's never too early to reach out.
Thank you so much. So, I want to thank all of you for all of the great expertise and tips and tools that you shared tonight. This was an excellent session. I also really want to thank OTIP for partnering with June Health to bring this information to your membership. So important that we continue the conversations as it relates to women's health and really create an environment that everyone is very comfortable, sharing and speaking up when they just don't feel like themselves, right? And seeking the support that they need. So, my final thought is I just want to encourage everyone to take time for yourself, put your own oxygen mask on first, advocate for yourself if you're not quite feeling in optimum health and be well. So thank you again for joining us. I hope everyone has a great evening, and let's hope this beautiful weather keeps up tomorrow.
Thanks, everybody. Have a good
Thank
night.
you, everyone. Have a good
Thank
night.
you. Have a good evening.